Upstate Medical University in Syracuse, New York invites you to be the informed patient with the podcast that features experts from Central New York's only academic medical center. I'm your host, Amber Smith. Weight loss surgery reduces the size of the stomach and sometimes also the intestines, but it also has an effect on the ecosystem within the gut. Here to explain is Dr. Timothy Shope, the Division Chief of Bariatric Surgery at Upstate. Welcome back to The Informed Patient, Dr. Shope.
Well, thanks for having me back, Amber.
You're one of the authors of a paper about the gut microbiome published in the official journal of the American Society for Metabolic and Bariatric Surgery. Can you give us a definition of the gut microbiome?
Sure. I helped write this paper as part of the Clinical Issues Committee for the American Society of Metabolic and Bariatric Surgery with colleagues from across the country. We were looking at how the gut microbiome affects obesity and related diseases and how treating obesity impacts the gut microbiome. The gut microbiome can be broadly defined as the complex population of microscopic organisms that live in our GI tracts.
So are these microorganisms healthy for us? They're good for us, or do they cause problems?
All got differing contents in our GI tract, these microorganisms. Some of them can cause disease. Most of them are generally good or don't cause any problems for us.
If we all have different or slightly different microbiomes, what influences the makeup of the microbiome?
So each of us has probably trillions of these organisms in our GI tract. The organisms can be bacteria, fungal elements, viral particles, even protozoans. With all of the potential combinations of these bacteria, there's going to be different microbiome within each one of us.
So do our genes play a role in that, or is it our diet, or what determines how many or what type of all of these organisms are there?
There are actually a lot of factors. Our environment is a big one. Geography and ecology of where we live. For example, the geography of Syracuse is very different than Arizona or maybe Paris, France. So there's going to be differences in people that live in those areas. Genetic makeup is important, as is our diet.
What effect does the microbiome have on our bodies?
Well, there needs to be a certain balance of the types of these organisms to promote and maintain normal, healthy lining of the GI tract. If that balance is off, so for example, from a diet that's high in fat, the lining can be damaged. The damage can lead to obesity and other diseases like heart disease, diabetes, liver and kidney problems, Alzheimer's, and certain types of cancers.
Are some of these organisms associated with obesity?
Yes, they are, actually. It's one of the diseases that we can help treat by modifying the gut microbiome.
How different are the obesity-associated bacteria than other bacteria that are not associated with obesity? Do they move differently? Do they do different things to us?
No, they're just different types of bacteria usually. Some of them that are associated with obesity, for example, are bacteria that cause a lot of fermentation within our GI tract. They have names, but most people, including me, really wouldn't recognize them. They're really efficient at helping to break down food into simple sugars, short-chain fatty acids, and this increases the amount of calories that we can absorb to be stored as fat. Some of these are associated with insulin resistance, and some other bacteria make it easy for others to break down fiber into more absorbable calories.
Can you tell us how weight loss surgery affects the gut microbiome?
So metabolic and bariatric surgery changes the content and the makeup of the gut microbiome. The operations generally decrease the unfavorable bacteria and increase the favorable ones. The favorable ones are less efficient at extracting calories, may help preserve the GI tract lining, reducing inflammation, and alter how we absorb bile acids. To be fair, we do see similar changes in the gut microbiome after substantial weight loss from non-surgical methods as well.
Do the various surgical techniques create different impacts on the microbiome? Because I know there's different ways you can do the surgery.
They do. Both of our most common operations, being the gastric bypass and the sleeve gastrectomy, show similar favorable changes to the gut microbiome. Some studies have shown that the bypass may have a little bit better of an increase in the beneficial bacteria, but for sure, both of them do have a benefit here. It may be based on a more substantial impact of the bile acid metabolism that's seen in gastric bypass. That may be responsible for the difference between the two operations. But both of them create a more favorable balance with the bacteria that are associated with lean body mass. It's far superior, for example, than the adjustable gastric band benefit. And we don't yet have enough information on some of the newer operations, the duodenal switch operation, for example. And it's also, again, worth reminding your listeners that all of these procedures, or even those non-surgical weight loss efforts, are going to provide some benefit.
So, is the change in the microbiome the reason people lose weight, or is it the surgery?
That's part of it. The surgery helps by other mechanisms, but again, we can see some of these changes with non-surgical weight loss efforts.
So, we've talked in the past about how weight loss surgery can cause metabolic changes that can cure type 2 diabetes. Is the new microbiome responsible for that?
It's part of it for sure.
What can you tell us about the use of probiotics or prebiotics in connection with weight loss surgery?
Well, there's minimal impact of the probiotics and prebiotics for weight loss. I mean, there's no study that's going to show that simply taking those supplements in our diet is going to promote substantial weight loss.
Can you kind of describe the difference between probiotics and prebiotics? Because they're not the same thing, right?
They aren't. Probiotics are actually living microorganisms. These are bacteria essentially that we ingest. Yogurt, for example, gummies that you might get at the pharmacy or local store, they create a favorable balance that facilitates weight loss and might help improve some medical problems like diabetes. There's also probably more of a benefit toward the immune function of our GI tract than in helping promote weight loss. The prebiotics are actually non-digestible food that we eat that are used by the gut microbiome to create and impact things like fiber, short-chain fatty acids, like decrease insulin resistance, decrease inflammation, and actually helps to increase the GLP-1 hormone, which is what a lot of these newer weight loss medications are based on.
So, your surgical patients, are they often taking probiotics or prebiotics?
We suggest that honestly, most of them do eat yogurt early on after weight loss surgery. It's something that they can tolerate well and gives them not just the benefit of the favorable bacteriology, but also the good calories, good protein. So that's something that we suggest in the early time period. They certainly can be on that for much longer term. We don't necessarily suggest that they have to be on either probiotics or prebiotics long term. Again, there's no real science that suggests it promotes additional weight loss.
This is Upstate's The Informed Patient podcast. I'm your host, Amber Smith, talking with Dr. Timothy Shope, the Division Chief of Bariatric Surgery at Upstate. Is there an understanding of how surgery and the microbiome interact with the patient's own metabolism?
I don't think we understand all of that yet. Probably varies greatly based on the type of surgery and on the individual's own gut microbiome. And it's going to change how we metabolize bile acids, increase expression of hormones like GLP-1, decrease hunger, improve control of blood sugar, and helps with weight loss.
So there's still much more to learn about it, it sounds like.
There is. We know that there are changes certainly from having surgery to the gut microbiome, but it's just going to vary so greatly, again, based on the procedure that was done for the patient and their own native microbiome.
Looking ahead, what would be a microbiome-based strategy for weight loss surgery?
It's actually an interesting topic. Changing the gut microbiome has been used to treat other diseases, primarily of the colon, things like C. difficile colitis. It requires a procedure called fecal microbiota transplant or fecal transplant. The studies on this for weight loss are minimal. They've not shown any substantial benefit for patients. But thinking ahead, you could imagine trying to maximize weight loss and control medical problems by optimizing the gut microbiome either before or after surgery, and then having the surgery that'll help maintain that state long term. That's purely theoretical stuff. We don't know enough about it yet, and it's not really been tried with any success.
Do you think it would affect who would qualify for surgery or who would be a good candidate for surgery?
No, probably not. The patient's going to be a candidate for surgery based on other factors. The surgeries will help change the gut microbiome independent of which one's done, but changing the microbiome preoperatively wouldn't really alter candidacy. It would just really sort of change the starting point for the patient as far as how well they might be able to lose some weight.
Would it have an effect on side effects from the surgery?
Probably not. One of the side effects that we do see fairly commonly after weight loss surgery is some bowel function issues, constipation primarily. That's a multifactorial problem. So changing the gut microbiome may help a little bit with it, but I don't know that we can say definitively it would alleviate that problem.
Now, let me ask you about the weight loss medications that have become so popular. Do they have an effect on the microbiome?
Well, the GLP-1 medications do seem to help promote that favorable balance of bacteria that we were talking about. There may be some added benefit based on the dietary changes and other lifestyle changes that people that are on these medications should be making if they're serious about weight loss. So again, that might be multifactorial. Remember, though, that this kind of works both ways. The favorable balance of the bacteria also increases the expression of the GLP-1 hormone. So you get the benefit from both directions.
Do you have surgery patients who are on the GLP-1 medications?
We do. Our program is actually a comprehensive program for the care of obese patients. We don't just offer surgery. We have patients that are on these medications. Some of them come to us already on the medications, seeking weight loss surgery, or maybe seeking us to take over the care and management of the weight loss medications. Some of them come to us looking for them. Some are hoping to combine the use of them with surgery. And we also have patients that started them years after surgery. Maybe they've regained a modest amount of weight and they want to curb that before it becomes really problematic for them. And we've used these with reasonable success in people 10, 15 years after weight loss surgery. I don't think these medications are a replacement for surgery, and I don't think they ever really will be, but they can be a useful adjunct in managing the disease.
One of the things I've read about them is that once you start taking them, you generally continue taking them because if you stop taking them, you're likely to regain the weight. Would you ever do the surgery so that a person could stop taking the medication?
Yeah, we do these kinds of surgeries so patients can stop taking all kinds of medications. So we want to get them off their diabetic medications, hypertension medicine, all that kind of thing. So it would be perfectly reasonable for them to come off of these medications. You're right, though. We really don't know what happens to a population of patients after they stop taking these medications. There's anecdotal evidence of people regaining all of their weight back. Some probably gain a modest amount of weight. I think if the people that actually make serious efforts and don't just take the medications, they alter their dietary intake, they enhance their physical activity, those people probably have a better chance of maintaining the weight loss that they get from the medications. The surgery will help them to sustain the weight loss for sure. We know that sustained weight loss after surgery is far superior to anything else.
Well, Dr. Shope, I want to thank you so much for making time for this interview.
No problem. Happy to do it, Amber.
My guest has been Dr. Timothy Shope, the Division Chief of Bariatric Surgery at Upstate. The Informed Patient is a podcast covering health, science, and medicine, brought to you by Upstate Medical University in Syracuse, New York, and produced by Jim Howe, with sound engineering by Bill Brokel and graphic design by Dan Cameron. Find our archive of previous episodes at upstate.edu/informed. If you enjoyed this episode, please invite a friend to listen. You can also rate and review the Informed Patient podcast on Apple Podcasts, YouTube, or wherever you tune in. This is your host, Amber Smith, thanking you for listening.